Good morning, good afternoon, good evening. Welcome to BlackMentalHealthMatters.org. My name is Elsa Akrook, and I'll be your host today on a very special topic on technology and virtual health and the impact on mental health and its impact on mental health. And I have two great guests, Josephine Ebelman and Renee Badrani. Danielle, welcome to the show. I hope you're doing well. So before we get into this really, really important topic on technology and virtual mental health and how to impact not just mental health, but especially Black communities. So I'm going to start off by Josephine Abelman. If you can please introduce yourself, tell us who you are, what you do, where you're from, and why you do what you do.
Okay. My name is Josephine Emoma, and I am from Nigeria. I'm a mental health counselor. So what I do is I work with first-hand patients who are having mental health related issues, and also specifically for this topic we're going to be discussing, I am a virtual mental health counselor.
That's amazing. Danielle, is it you with the feedback in the background?
Hello.
Hi, can you hear us?
Yes, I can hear you very well, loud and clear.
Okay, perfect. Hi, if you can please introduce yourself, who you are, what you do, why you do what you do, and where you're from.
Okay, Daniel Delabaratibi is my name, and I'm here based in Uganda, Africa. And I do mental health advocacy. We do community-based mental health advocacy and psychosocial support. And also, I'm an author who has written multiple books based on my personal experience, especially even with mental health. And I'm glad to be a part of the show tonight. Thank you.
Yeah, thank you so much for both of you. You're both really just the right people for this show, especially for this topic on virtual health. And Josephine, the fact that you work in the virtual health world, which is kind of new, it's great. So thank you for joining us both. And like I said, today is such a great topic, especially in this day and age, a day and age that is a digital age, that is. And tech has opened, this new frontier in mental health and mental health support. And, mental health, especially through digital technology, has, its pros and cons, such as the convenience, but it has its cons, such as presence, etc., which you'll be talking about in a little bit. So hopefully we will cover and uncover some of these advantages and disadvantages, especially to Black communities. Has it been good, has it been bad, and in what way? So this will be a great way to kind of introduce the day and age of digital health and virtual health in the context of mental health, especially in Black communities. So with that said, I would like us first to define what we're talking about when we're talking about virtual health. So Josephine, you're on my screen first. I'm going to go ahead with you, and then Daniel, you can follow. The first question is, what is virtual health?
Okay, virtual health is using digital tools to communicate to your clients. So mental health service providers use digital tools in form of WhatsApp, Google Doc, Google Drive, Zoom link. If in terms of the tools like phones, laptops, inbuilt apps to render mental health services to their clients. And in this regard, it has helped mental health. The service providers have been able to reach wider audience, and it has also helped the service provider to look for different ways and avenues in making sure that mental health services are getting to the people that really need them.
Yeah, that's a very good way of defining it. Thank you, Josephine. Danielle, would you like to add something to it?
Yeah, basically, virtual health, like my sister Josephine has said it here, is a tool where people use their gadgets socially so that people can be able to use it, like mostly social media, to be able to access information on mental health, and maybe toll-free numbers where somebody can call in and then they can listen in some information where they can get details on mental health issues like that, using the technology of the latest gadgets.
Yeah.
Thank you.
Yeah, that makes sense. In that case, I think we both answered the second question a little bit more. Then, how would you define technology within the context of mental health?
Okay, in defining technology, I would say standardized tools that are digital and are very and that people are very familiar with.
Mm-hmm.
So in the organization I work with, we had a website and we had an app.
Josephine, can you hear us? You froze there a little bit, so. Can you hear us
I'm
now?
sorry, you lost me.
Oh yeah, we lost you. It's okay.
Oh yes, I can. So
okay.
So like the organization, like I said, I'm working with currently, I mean. So we did a website and then we found out that people were not going to this website, right?
Mm-hmm.
And we thought since people needed mental health services, if we preached to them about using websites or using apps, they would be thrilled to use such medium, but it wasn't
Mm-hmm.
possible that way. So we had to go as far as using WhatsApp.
Right.
So we had to use WhatsApp. And then on the website, we had to say contact so number, and then you'll be paired with a counselor or a psychologist based on what you want. And that was how we were able to communicate to people. So technology in this context means using a tool that is very common to people and something that is also very accessible and what people would want to use over and over again.
Mm-hmm.
Thank you.
Yeah, no, that's a very good response, especially the fact that it's adaptive. So you talked about from a website to a customizing to someone else's needs, so through WhatsApp. So which follows the next question to Danielle. So how has this technology, I guess the use of Progressive from websites to WhatsApp and to other forms of app, so has it been a frontier? Like, has it been, this giant tool to mental health and mental health support services? So if you can elaborate on that a little bit.
Yeah, sure. Using these gadgets, using technology for mental health has really been helpful, because personally I do it a lot, because I create content relating to mental health, and I can easily share this content through WhatsApp, through YouTube, through Facebook, so that people can be able to access this kind of information and it helps them. So it has been very helpful. Though when you look at the extreme side, we are going to, I think, look at it because it has both the negative point and the positive side. But on the positive side, yeah, it is actually reaching more people. And actually, we are using that to reach to thousands and millions of people. Right now, I'm in Africa, I'm in Uganda, but on weekly basis, I reach millions through Facebook, through YouTube, through WhatsApp, through Twitter, through LinkedIn. So it is really a very useful tool that we can be able to access information to do with mental health. Yeah, thank you.
No, it's a very good point. And you touched on the follow-up question, because I think you both alluded to websites, to WhatsApp, YouTube, to LinkedIn, and to other sources. But these are the ones that kind of confounded the new era of digital age, because people still use these tools. But we also have apps now, right? These mental health apps, mental health services. So I think you both talked about the advantages and disadvantages of, the WhatsApp, the YouTube, the LinkedIn that everybody still uses, but I think we've progressively moved on to different, forms like mental health apps. So to start off with Josephine again, what are the pros and cons of these mental health apps?
Oh, okay. I'll first by saying that mental health was known back then as face-to-face contact, right? You get to sit with your therapist or your counselor or your psychologist or psychiatrist and have these conversations. But now that people are becoming or going digital and using apps and using some other tools like Zoom or having Google Drive, the advantages are quite more, but the disadvantages should not be disregarded. So I'm going to give life experiences because I'm in this field. I'm not going to talk maybe based on what is happening technologically or things like that. So when it comes to advantage, I found that we could assess a lot of people. And by assessing, I mean people who readily would not come for therapy or would not want to even hear what mental health challenges are. You see them coming for therapy, right? And then when we started, our objective, My Care Body, that's the organization I work with. They wanted the situation whereby there's privacy for these people. So using these apps or other tools was a way of making it private. People don't get to see, or you will just be chatting with a counselor and like someone doesn't know that that's what you're doing. And I can remember having a case of a lady who was so scared of her husband because she was going, like, I think her husband strangled her or something like that, and she was planning on divorcing him. But that was her own idea and choice to make. So I had to tell her when she was done with the chat, she should delete it to avoid any other outburst. And so that was in terms of privacy, yes, and that's how that one works. And then I also found that it helped both counselors and individuals. And in this sense, if it's chat, right, the individual can still go back to this chat and read what we have discussed so far.
Right.
right? You don't need to start maybe remembering or jotting down. Some people lose their piece of paper or things like that. But since it's chat and it's there, I also go back in case of returning individuals. So I go to read the whole chat and then I see that, oh, this was what we're doing, and this has helped me. For example, in the case of, I have this lady from Egypt, Basant, and then she, it wasn't really easy for her. So, and then she kept coming and coming.
Yes.
So what helped me also, because I wasn't jotting down maybe in my book or on my laptop for maybe future recommendation, it was the chat that helped me.
Right.
And when I mean coming and coming, she might just, you may not see her for like a month and then she
Yeah.
appears the next month. So how am I going to keep up and go to check, oh, where did I save this girl's document and
Right.
things like that? So it really helped me. And she also told me she usually go back to the chat to read them and
Right.
try to do those things. So, and then it's not expensive, right? You don't get to spend money on office space. It's
Right.
quite cheap for both service providers and also for individuals. You don't get to use transport to go to somebody's office to sit down for long hours, right? Now, for the disadvantage,
Right.
it should not be. It's the disadvantage is it's quite tricky though.
Yeah.
But one disadvantage I have found over time is that you get to lose your client in terms of connectivity.
Right.
And like
Right.
we're saying backstage, Elsa, um,
Mhm.
when I am chatting with an individual and we've agreed that it's going to be a 1 hour session and you have to be there and we've scheduled a time, I've cancelled appointments and I'm just there waiting and chatting you up, and sometimes the client doesn't respond. And if eventually they get to see your chat, you hear something like, oh, I was busy, oh, I slept off, oh, my baby was sick, and things like that. And then sometimes I've had situations where clients got angry because I did not respond promptly. And
Right.
yes, I can give an example, right? And I had this client, my organization sent me this client to work with. And then she said,
Oh, we lost you again, Josephine.
sorry, she sent me a message, but I wasn't I wasn't available to respond immediately. So when
Right.
I responded, she said, oh, I don't need your services anymore. And I was like, may I know the reason why?
Mhm.
And she said, well, she she doesn't feel like talking to anybody anymore. And I told her I had to be very diplomatic about it.
Right. Right.
Um, I know sometimes our clients feel entitled, but it shouldn't get to me, right? So I told her that, um, okay, if you don't feel like talking about it, there's no problem. Just whenever you feel like talking, contact this number and then the person would respond to you and send a counselor. I had another scenario where the lady wanted morning sessions.
Mhm.
And most times I do my sessions 12 p.m. to 12 a.m.
Right.
So you can pick your time. But my
Right.
mornings, when I wake up by 6, or sometimes I wake up later than that, I need it for myself.
Right.
So I tried explaining it like that to this client, but she wasn't hearing it. And
Mhm.
then and then she said no, she if let me paraphrase what she typed. She said, if it's not a morning session, then what's the point having the therapy? I told her, okay, I'm going to refer you to someone who I feel would be. I have colleagues who would take morning sessions, so I feel you should go back and contact so number, and through that way you'll get someone that will do morning sessions for you. So those are, although I have some other cons, but I would allow my other colleagues to also explain his own side as regards this pros and cons in using virtual tools.
Yes, absolutely. I think you've highlighted so many really, really good benefits to it and challenges as well. Daniel, would you like to add more into the pros and cons of mental health apps? You're on mute, so would you like to unmute? And
Oh, yeah. Yeah, thank you. I think she has really brought it out very well. What happens is the pros is that I want to begin from the perspective that in our African Black community, issues of mental health, issues of depression, issues of suicide, these are taboo topics for discussion. So in most cases, people try to hide away from those discussions. And then when now we have the virtual platforms, when we now have the social media to use and access this kind of information without face-to-face interaction with other people, kind of it gives people a better morale to be able to, because even here in Uganda, many people are living in denial. We just did the research, and it was reported that 14 million Ugandans are mentally ill, but not all of them can go boldly to access treatment because of fear of stigma, because of fear of what will others say when they see me go to see a therapist. What will they say when they see me go to access this kind of service? But then when you have the online platform, where like here we have Mental Health Uganda has it, where there is a toll-free number, you dial in wherever you are, so that you can access information on mental health on your own, wherever you are, either through WhatsApp. You can download it, you can check it on the website, you can customize it to your own setting. So kind of it gives people the zeal to live still in their denial, but they're still privately access information that can actually help them. And that is one thing that is common here. That's why even here, I keep creating content. I keep making this, and then I share it in the social media platforms. And then others reach out one-on-one. They say, please, the other thing you shared was really helpful for me. Okay, when is the next episode?
Right.
When's the next one? When can we get the next one? Because people are living in denial. People are living in a place where they don't want people actually to know that actually they are struggling with this condition. So it helps to communicate and stay up to date when they are trying to get this kind of information. And then also it helps to promote themselves as they try to access this kind of thing. And they seek and offer emotional support during their tough times by themselves, without necessarily reaching to somebody. And also to find an outlet to have expressions. They can be able to access this kind of thing. However, on the negative side, like she said, there is where you lose touch with somebody, you cannot really understand how deep their issue is, because they will always be living in denial, and they will claim that everything is okay. Because I have been there. I suffer depression, so I know how we live in denial, say I'm okay. I don't need to take medication. I don't need to go for therapies. I don't need to do this because you're living in denial. And because now when people try to access information by themselves on their own, then they lose touch with the reality. They lose touch with the therapists. They lose touch with the people who could actually help them better, apart from the online engagements. And then also, the other biggest challenge I have also realized here is the whole bit of isolation. Because people now choose to isolate themselves from the rest of the people. Then they say, after all, if I need help, I will download, or I will search in this website, or I will access from this platform. So they try to hide themselves in a place where they can keep isolating themselves from reality. And then things keep moving and things keep attacking them. So basically, that is what I can add for now. Thank you.
Yeah, no, those are really, really, there's just so many great information to take away from both sides. And I think you both highlighted one thing is that, first of all, from the African context where culture is really, really dense, we all have, three of us come from very like homogenous cultural backgrounds. And I know there's cultural shame associated with wanting to access mental health, or because in some cases you're considered, the devil if you have, if you're acting up because of like a mental health illness. So it kind of really benefits those that, can't talk to their parents or can't talk to their friends because there's a cultural stigma associated with mental health, right? So like you said, Daniel, so for those people, it's comforting to know that they can access that social service, they can access, it's the virtual world is in a way healing to them or therapeutic to them, even though they're not seeking it. But what Josephine, what you said about, the same way that we love the app because you're afraid to talk to someone, or if you lose the touch of, what did I say to this person? You can always go back to the chat. You can always go back to the file because it's there, as opposed to, I used to work in mental health services, and we talked about this backstage, Josephine. I used to have charts of like this much and be like, oh my God, what page was this? What page was this history? And now it's like you could just Control F and find it and just say, oh, it was right there, because everything is digital. So there is a really, really huge advantage to it, because that virtual access, like I can access, as a doctor, for example, that if I can have access to the patient in front of me, I can always look through their file in the comfort of my own home and say, you know what, I can give them a call and I can talk to them because I have their charts with me. So the very same technology that has been such a great tool, there's also, of course, side effects, I call them, or disadvantages that come with it, such as someone expecting you, Josephine, to be available to them in the morning just because it's virtual. That higher expectation of to say, well, but it's virtual, you should be available, when but you're talking to another human being that also has a life, that also has other clients. And so I think it also comes with the, well, it's virtual, so that means I should have access to it 24/7. But it's like, well, you're accessing another human being, so that human being also has a life. So you can have them, but also accommodate by saying, yes, but I can refer you to a colleague that will serve to your needs of being available in the morning. And I see the advantages, but also disadvantages, even to the support providers. And I think that's something we talked about a little bit, is that the providers themselves also have to adjust the person's needs and the person's virtual needs, because there's also virtual challenges. Not a lot of people, want to use the virtual side. And one thing you both said that really is the most important one out of all is that we are proactive human beings. So we're also, by choosing these services in this, they're good for us, for some people that, are introverts, for example, they'd rather be, or those that are, culturally fearful of being shamed by their communities. So for those people, it's very advantageous. But for people that are very interactive, very social, and they want to be in person to express themselves, I think it's taking that element out in the virtual sense. And that's both. That's something you both said, that that it kind of hits home, because now I could just open up a computer and talk to someone, but I miss that person's interactions, that person's facial expression, that person's body language, and a lot of like the nonverbal communication. Like I'm using my hands as I'm speaking, and that you miss that essence by being virtual, because then those elements help get to know the person better, and you can treat them better. So that was a very challenging question, but I'm glad you really brought up
Excuse, I just wanted to add something small there. You've actually just said something which is very pertinent that has happened to me. You find that there are times when you are doing a virtual meeting with somebody, right? Mm-hmm. And they can affect life. For instance, wherever they are, they can choose to put a different background that shows us somewhere else when actually they are not.
Right.
Or they can try to, or when you are chatting maybe virtually, or when you're communicating, they can use emojis, which is the opposite of what really they're going through. So
Right.
we are living this life where we are forging it. We kind of camouflage reality. So it is hard to really understand. That's the other challenge. It is hard to understand really what's going on, because somebody will be able to fake this life. Check social media. People will post lively photos, but actually when they're hurting. And then you will hear that someone has committed suicide. You'll say, but how? You were so happy the other day. You were somewhere. But actually when it was actually fake stuff. So that's where the challenge is. That's what I wanted to just add. Thank you.
Yeah, no, that's a very good point. We're falsifying an image of what we are versus how we feel. Josephine, do you want to add anything to that? Because you are a virtual health counselor. So,
Yeah, in counseling, you have to look at person's behavior in order to draw a conclusion, right? So it's not about listening to what the person is saying or what the person has not said. You have to look for non-verbal cues, like maybe the way the person is sitting, the hands, if they're sweating, if the person is sniffing all the time, to know if maybe they're into drugs and things like that. But we chat, I'm not sure we get to know. And then there's sometimes I do have issues. I've had series of clients who come to meet me with half news, so or half talk. So when I start asking questions, because I know I'm good at asking questions that will make you sweat, because you're saying A, you're saying B, and then you jump to D, and I'm trying to pinpoint where the C is going to come out in all this, and you're giving me half baked news. When I start asking questions, you see, a 1 hour session gets to turn into 2 hours, 30 minutes, and you get to see clients who will say, oh, I'm sorry, I didn't add this along the line, and I'm like, for the fact that it's chat, I'm not here to judge you, right? So you should you should know that through chat or voice notes you can pour out whatever you want to say. You're not seeing my facial expression if you think I'm judging you. So I don't know why you want me to give you good recommendations and or offer choices for you to pick, and then you're not giving me the tools I need to make all this work for both of us. So I found people coming with half, and most times, if it was through facial one-on-one interaction, you get to see if someone is lying, maybe through their eyes, through the way they'll behave, maybe the sitting down, the fidgeting. You'll know through that way that okay, something is not adding up. But with chat, we don't get to see all that.
Right. I think there's the virtual cues. I think you have to adapt to understanding that person's virtual environment. And I'm sure it's a lot more challenging. So
it is.
For even being a virtual counselor, because I already find it tough even just interacting with people just on video, because like I said, like we're humans with, like, we need human connection, whether even it's not physical, but the physical presence of that person could really bring out the different elements that we have as social beings. So that was a very good, especially the way you said it, Daniel, and that the virtual emojis, I think they really stuck with me, is because you're falsifying who you are in the presence of technology, whereas someone like Josephine is trying to understand the person to recommend the right tools to help that person, but that person is not giving her as much as, and they're being conscious even though it's a virtual world. So it really has a lot of good and bad elements, and I'm glad that we're discussing them, which leads me to my next question. I guess, Danielle, you can start on this one. So have we seen, because we're still talking about these mental health apps, have we seen any changes to these mental health apps? Like, are we seeing the rise of racial minority apps, like, apps for like Black communities, Black mental health, and that sort of thing? So are we seeing any changes, and are we seeing, I guess, a good rise of mental health apps that are catered to Black communities or people of color? You're on mute, Daniel.
And thank you. Yeah, I think that is a good question. Like here, let me use Uganda as an example because it's where I am. So far, we have several apps that have been designed for mental health. And even toll-free numbers, somebody can call in, you dial in that number, and then you can access whatever information you need on mental health. And those apps are actually growing. So many organizations are coming with those apps, and it is really helping. Like I said, it is helping in the sense that most Ugandans and Africans at large and the Black community, we prefer still going underground. We don't want to boldly come out to break the silence that actually I need help.
Right.
So people actually mostly prefer those apps, and they're actually embracing it heavily, more compared to going to see a doctor or going to see a mental health professional or things like that. So it is really on the rise, and here in Africa, it is actually growing. Every other day, a new app is actually coming up in line with mental health.
Yeah. I mean, it's very good to hear. Is it the same for you, Josephine, and where you are?
Okay. I've seen lots of apps, and like I said, I volunteer for two organizations, and the one is trying to set up the app, the other one has the app already, but it's not really in function right now. And so the two uses websites, right?
Right.
So there was a lot of advocacy and awareness for people to use this app or website. And let me not say app, like website, like going online and searching. So we had to do lots of advocacy, lots of awareness. We had to tell people that okay, I had to do outreach here on behalf of my organization for my on how we were trying to make mental health accessible by visiting mycarebody.org and all those things. So we had to do lots of awareness. And I found that the fact that people are technologically inclined when it comes to mental health, I'm not sure they're interested in hearing if it was an app or in person. So it's when they have I had a feeling maybe the ads we did or maybe the outreach, we happened to talk to people who were having challenges at that particular time.
Right.
Yeah. So and then you see them like coming on board. So another way, what we also did was partner with organizations who had wider reach, who had wider audience. Sorry,
Right.
and through that way, we were able to talk to those people for them to also come for mental health service. So I would not say people do not necessarily want to use apps or the website, but in joining Daniel's voice, I would add that we would have to do lots of outreach and awareness and advocacy as we're doing for mental health for the usage of these apps and websites.
I mean, yeah, like you said, it definitely brings it comes with challenges of not just creating an app, because if you're living in a
Yes.
day where in a day and age where everyone has a phone, because we're talking about access too, right? It's if they see a website and they're more inclined because they're a website user, sure, they're going to go ahead. But if app is like foreign to them, because apps are a new concept if you really think about it, because we never had apps. We had BlackBerry maybe like what, 10 years ago. We didn't even know what apps were. We were just happy there was Messenger to like talk to people.
Exactly.
So now it's like there's something in it for everyone, but it's really nice to see at least the rise, especially it's something that you both alluded to, the rise of these apps or these services or services through these apps for very culturally dense communities like Africa is, where I come from, where you both come from. Like I said, we're very interactive, but it also helps those that are, that know they'll be shamed, so they'd rather use the apps because it
Exactly.
helps them and it's therapeutic to them. So it really is, like I said, I always have this love and hate relationship with technology, especially for mental health. So it's really nice to see that at least the upside is that it benefits, a lot of like cultural communities, because first of all, mental health doesn't even get acknowledged as a disease, right? And that's something we didn't talk about enough, which we will in the later questions. So which actually, this kind of brings me to the next topic, which we can talk about cultural or historical context. Is anyone can jump in and answer this. So has this new era of virtual technology, so the day and age that we're using technology for mental health apps, has it changed the way we shape mental health concepts? Or how has it shaped the way we think about mental health concepts, I guess?
Okay, I would go. I'm going to bring two arguments as regarding this. Um, I'm not going to lie. Although we will get there, I am very hopeful, but people still think that coming for a therapy session means you're mad and
Mhm.
and you're going crazy. And I can say this for the fact that I did an outreach in the suburbs, in the capital city here, and I had so there was when a group is done with their medical checkup, they come to meet me. So I was with this other group and I was trying to talk to them about what we're into and why mental health was something they should look into. And some people were nodding their heads, and I had this man who who was on his phone, and I had to approach him personally to say, "How is he doing?" And I was talking about mental health, and then he said, "Oh, he's fine. He doesn't need that." And I said, "Even me as a counselor, I go for therapy sessions
Mhm.
too." And so I do not understand why, or is there a way you're using that I do not know? I would like you to share with me.
Mhm.
And he was like, he cancels people. He's the one that gives maybe a form like boosting or energy to people. So
Oh, right.
he doesn't need it, right?
Right.
And it was very disheartening.
Mhm.
It was so disheartening, and I was like, well, we still have a lot of work to do.
Yeah.
We still have a lot of work to do. But moving forward, people are becoming aware.
Mhm.
They might not be taking action immediately, but we're already watering the beds in their mind.
Yeah.
And I believe if we continue to do more
Mhm.
and more, like the way this Black mental health matters is
Mhm.
doing, if we continue to put it out there, it would help people take action more.
Mhm.
So students especially are beginning to come for therapy sessions when they're having career
Right.
malfunction.
Right.
Um, you see some students who want, because I'm also a career counselor, so you see students who would want to seek advice on how to build their own career or which career is in vogue and things like that. So if with career, we as therapists, advocates, psychologists can just help people and then use that medium to also inculcate mental health, it's really, really going to help, right?
Yeah.
And then if organizations who have employees can also talk about mental health in the organization, it's really going to help. And if people who are doing monitoring and evaluation in NGOs go to all these suburbs, and when they're doing their programs, training people, come to pick someone indigenous,
Yes.
right? Because most of all these things is not about English speaking. Someone indigenous to go and talk to them about mental health is really, really going to help. So those are my two arguments that I just presented.
No, they're brilliant. You talked about language within the context, and you talked about even going to rural areas where I'm pretty sure they don't know what mental health is because it's a foreign concept. It still is, and that's why I know I rephrased the question of how has this technology changed the way we shape mental health? And like you said, in a good way, where there's the disheartening reason where some people say, well, I don't need mental health, even though I'm a counselor, where it's like we're all susceptible to problems and we have problems every day. It's just the way it's how we approach to treat that problem that defines us as a person. And I think it's nice that at least, like you said, we have a long way to go. And I really 100% agree, because these concepts are still like language. How do we define mental health? I still struggle with defining mental health, even for my language, to my parents, to explain to them, because if I do direct translation, it just means headache, and they assume it's like headache, so I'm still trying to find a way. So, and like you talked about indigenous language too, which is it's not highly spoken by anybody except indigenous communities. So how are we catering, how are we adjusting these technology, these apps to cater to people of cultural background, different languages, or different approaches to health, even because not everybody wants to do, because they assume mental health means in some cultures that you're crazy or you're acting bad when it isn't, right? So to kind of have to find that medium to redefine these concepts through the technology, I'm sure it's challenging. So it's a very good way of putting those arguments, Joseph. Daniel, would you like to add anything to Josephine's points? On your
yeah, just quick one. Yeah, just quickly. Here in Uganda, particularly in the urban centers and the cities, people have access to smartphones, and they can easily access this kind of information. But in the rural areas, people still have the analog phones, these old model phones, which cannot access information.
Right.
So you realize that it kind of becomes challenging to have both at the village setting and the urban setting. Right. So that's where we engage mostly on a community-based mental health, so that if it is the community of urban setting, for instance, there we encourage them, since they have the smartphones, we ask them, please, you can actually download these apps. You can actually access information here in case you fear coming up, but still we need to reach out, because at the end of the day, we need to have one-on-one. And then for other communities, we actually go down to the grassroots and then engage the locals in the local languages. Because if you go to my language, for example, we speak Lugbara. If you speak mental health in Lugbara, we don't understand it. But there is a way in our local language, it can actually be interpreted, actually it can be explained, because people have ever suffered from it, and they actually understand it in the local content. So, and then we also try to see how can we be able to have these apps in the local content, so that even the local person can actually access it. And then we can be able to have this, but still be able to encourage, in as much as we are having these online platforms where you can actually access this kind of information, still we need one-on-one engagements. You need to see somebody, you need to see physically, because at the end of the day, the other challenge that comes with it is people are doing self-medication actually when it comes to mental health issues. Because somebody says, I can actually access this kind of information, and then they want to do it by themselves, and they're not even doing it right. But because they just heard it from the app, or they saw it, and then they maybe watched it, and then say, okay, this is how it is done, so let me also do it. So before you know it, it actually becomes more harmful. And at the end of the day, actually, many people are actually having now even mental health challenges as a result of that self-medications or self-treatment and care, because they fear coming out to be able to seek for help. But ideally, bringing it to the local content really works, and I have seen it work. And that's why we are trying to see, okay, even the materials we have in English, how can we translate them into the local content, the local language, so that somebody in the village can be able to understand it in their own language and in their own context. Because the whole thing, what works in Kampala cannot work up country in Moroto. What works here in Kampala cannot work in Arua, where I come from, for instance. So we can see, how do we contextualize this? And then also, we are from different cultural backgrounds. My culture is different. My culture has some beliefs which is different from other cultures. So then we will be able to say, okay, how does this apply for us? How can this apply for us? How did the forefathers, how did the people of long ago, how did they manage their mental health issues? And then how can we build from that? How do we improve it? But at the end of the day, how can we bring out to the whole masses that actually we need to have more awareness? Because mental health has a lot of stigma with it. People can give you the derogative names. When somebody has a mental breakdown, they point fingers, they begin to blame, they begin to accuse, instead of supporting them and helping them. So we are trying to say, okay, how do we come in so that we're able to help people understand that actually these issues affect anybody, regardless of status, because we've seen kings who have had issues like that. We have also seen different people who have been engaged with these mental health issues. So it comes back to us to understand that, hey, we need to engage, we need to continue helping people, we need to create more awareness. So we need to continuously create awareness so that people are helped.
Yeah, no,
that is absolutely. What I could.
Oh, I hope you didn't lose Daniel. No, that's a very, very good way of putting it. And it alludes to what Josephine, what you said about we have a long way to go, because Daniel just gave an example of, how even tribally, like mental health has different, in some cultures you have to explain it a certain way, but the fact that you still need the one-on-one, you still have a lot more progress to be able to redefine these concepts within the context of like your own language, your own tribal understanding, and your own, because it's the same way from where I come from as well, where in one language it means something else, in another language it means something else. That means it's going to translate differently, it's going to have different meaning, different interpretation. So you can misdiagnose something, or you can misrepresent the actual concept by just, tweaking like a little word or a little context. So I think we have a lot more way to go, but it's still nice to see that, people are actually using tools, mental health tools to understand even. I think understanding is like the first, door opener to, like Josephine, I really like what you said, watering the bed. We're watering their bed and we're letting them sleep in it. So at least they're getting, some sort of an eye opener into the fact that, oh, I can get treatment for this. I didn't know this was considered like an issue or a problem, because in some cultures it really is hush hush. Mental health is not something that's talked about because it's highly still stigmatized in a lot of communities, especially Black communities and Black cultures. So it's nice to see that we're on the positive route to see that that these services are available for those that don't want to, be stigmatized further by their communities. Which leads me to the next question. I was going to ask this question of, are virtual treatments better, but I think we're answering them as we go along. So this next question is, I guess, Josephine, you can start. So within the context of Black mental health and Black people's well-being, has the shift of technology and virtual health influenced the Black community? If so, in what way?
Okay. How does this affect Blacks' well-being? Um, we know it's not really ideal for a non-Black community to come and advertise like mental health care service to Blacks, because people would not want to patronize them. Um, as the same that it's as what Daniel said. What's happening in Kampala cannot happen in another part of Uganda there, right? So more Blacks are coming up. When I mean more Black mental health service providers are beginning to spring up from different parts of the country,
Right.
of Africa though. And then with that, each country can key into the mental health service provider that is in their own country. So this makes it please quite easier for um, people who have mental health related issues to communicate better with these service providers that are in their country. So technologically, um, people are coming different apps, different ways, different structures to see how it can accommodate everybody in their community.
Right.
Like for my own organization, when we started, um, we had just Nigeria in mind, obviously, because it's Nigeria centered, right? But when we partnered with another organization that was Pan African, we started having people from different part of Africa. Yes, I had clients from Ghana, Egypt, Botswana, Uganda, um, yes, Sudan, Zambia, Zimbabwe, South
Yeah.
Africa. Yes, so I've had clients like that, but um, I was in a situation where I had a client that was not from Nigeria, and as we were discussing, I kind of lost her, and I came to the conclusion that the reason why we were not connecting was because I really didn't understand based on what she, maybe because of we're in different parts of Africa,
Right.
right? And I believe if she had access to a mental health care provider, service provider in her own country, maybe it would be easier for her
Right.
to relate her issue, and then she will get recommendation. But those were kind of like the issues I faced. So um, service provider for mental health, we should try and at least get them all over Africa, so that communities can be able to key into this safe space that they are creating, and it will even be better because they will be able to understand um, the mental health related issues. I just hope I've been able to answer your question.
No, you did. You said like it's just you have to localize it. It's better if it's localized because someone like you're treating someone from Egypt, you may not understand the cultural associations of how they're feeling, and there's a lot more variables that are that you would have understood maybe who was in person as opposed to virtual, because then you could see the way that person is interacting. But I like the fact that yes, localized services are I find them personally better because then first of all, it's easy access, and second of all, someone that understands the language or that understands the various elements of the treatment plans that you're hoping to get from the service provider. Danielle, would you like to add anything to that from your perspective in
Yeah, from my perspective, like let me use Uganda and Africa as an example. In Uganda, we have different service providers, but then the point is how do we localize this content, and how do we contextualize it in our various tribal differences in the different tribes, and then but then still have the common issues so that it is standardized, so that whatever is in this local language or in this tribe, and at least there are basic things that must not deviate. You know, so the point is, how do we have something which is a standard across the board? And I remember a time when we, as service providers, we've been meeting here in Uganda, so that we are able to check. Okay, how do you do this? How are you doing here? How are you engaging here? What manuals do you use? How can we analyze this? How do we bring it to our own context? And then equally, I mean, various platforms like African Mental Health, we are trying to create also awareness globally through Africa. And then we are trying to say, okay, the different service providers on mental health, Uganda, Kenya, Tanzania, Ghana, Nigeria, Malawi, you know, Angola, South Africa, all of these countries, Egypt and all of that, how do we come together so that we can be able to have engagements together, so that we are able to come up with some concepts which are standard, so that we know, okay, this is how it is done here, but maybe this could also work here. Because almost, by the way, when you look at African languages, almost there are similarities even in cultures. My culture here in Uganda, among the Lugbara, we have similar cultures with the people from Nigeria. Actually, even our food, our way of life is the same. You know, so actually, when you begin to check through, you realize that actually we are almost the same people with the similar cultures, though we are in different locations, now speaking different languages, but almost the same principles are applying. So we are trying to see, okay, how can we build something which is a standard, and how can we create more awareness so that we can all be able to be of help? And then equally in the various Black communities outside Africa, how can we also be able to bring them our perspective, and then also they bring their own perspective, and we marry the two, but then still we have the same common issues affecting mental health, especially when it comes to some of these issues. So that is where we are going. I know it is going to take time, but still we will be there.
Yeah, no, that's very good. I mean, because I see the benefits of having a localized mental health services, but also the Pan-African approach that Josephine said earlier. It really is really nice to have that kind of setting, because then you're going to say, wow, there's a service for Africa, because just the relatability of our cultures, you know, like I'm from Ethiopia, and our cultures are very similar to the West and to the North, to the South. So it's the principle is there. Let me just give you an example of depression. We're all capable of being depressed, but it's how we receive the treatment plan that differs for me, for you, or for another person that is also having, depressive episodes. But at the end of the day, if you look at the criteria of depression, I may feel 8 out of the 10 of the criteria, the standardized criteria, because it's just a feeling of something, an abnormality within my mental health realm, right? So it's how can we cater that in such a way that I will understand the treatment plan that is more individualized to me, but how is it similar to a treatment plan that's individualized to someone from Nigeria or someone from Uganda or someone from Egypt? The treatment plan is different. I'm sure you're both aware of that, but the symptoms are the same. I'm still, the symptoms, like the way I feel, maybe the same as the way you feel or the way another patient feels. So it really is nice to have a standardized set, especially from the Pan-African perspective, because then at least if I look into this globalized platforms specifically catered to Africans, because then I can say, oh, this is for me, because it gives me the option to select the treatment plans, or it gives me the option of to select the person whom I want to go to. So I really like that it's moving into that shift of, standardizing the language so that it's applicable to all. But I also see the benefits of localization of mental health treatments, especially for those, like Josephine said, for virtual, that prefer just virtual world, and they just want to be able to access someone just because they're within the area. So thank you for answering that question so well, both of you. Which I guess alludes me to the next question. I think Josephine said earlier something about the website and adapting to a WhatsApp for those that can't, that don't want to use the website. So you cater to the shift to cater to that person's needs. So the next question, maybe Danielle, you can go first. So are we seeing an upward or downward trend in return users of mental health apps? Like, are we seeing like people using more, like again and again of the same service? Or are we seeing like a decrease in the use of mental health apps by like Black communities?
Actually, in terms of the use, yeah, I see actually the use is actually there. Many people actually opting for it. Like I said, from the background that mental health issues with a lot of stigma. So actually people are preferring to use it more than coming to see a therapist. So yeah, the use is really massive. People really need it. And like I was saying here earlier on, the issue is that people need this service, people need the apps, people need the information, but the access is still limited to the urban dwellers than the local village dwellers. So the use is actually more in urban settings where there is access to smartphones. But when you go to the villages where smartphones are limited, then the access is very small.
Yeah, so they're less likely to return because they may not have access as much as everybody else. Like I have a phone every day, so I can have access to more because I'm in an urban center. That's a very good point. Josephine, would you like to chime in on that?
When I was preparing my Excel sheet today for my clients, both for the returning and non-returning clients, I found that the statistics showed to me that for like from September till now, I've gotten referrals, right? Like people telling other people to come for therapy and that there's a platform like this. But from January till September, I had like 2 returning clients. I do not know what to say about that. Maybe we'll conduct a poll to ask questions why people are not returning for sessions. But what I could deduce from that was, I don't want to say upward or downward, but I want to use this. I want to say that people feel the fact that they have just 1 session that they're okay.
Right.
And since they are okay for the moment, we Africans, we know how to stay in a situation and it's killing us, but we're still there. It's killing us and we're still there. So because of 1 session, a client thinks they're okay and they don't need to come back. Not knowing the way you treat your physical health, the same way you treat your mental health. So the fact that you're giving a particular drug to take for 3 days, it means you should have your sessions for at least 4 times in a month, maybe once a week. And the reason why we're doing once a week is when we give you activities to do, we want a situation whereby you're giving time to do them, so you come back for we have feedback, like this is what happened, or it didn't work out, or things like that. But I believe we'll have to do advocacy around that too, right? We need to we'll do a lot of awareness the fact that we're preaching mental health, we will have to also preach what really inculcates mental health and how people are to go about it.
Right.
So basically that's what I see. I don't want to use the word maybe upward or downward, since we are still trying to preach mental health to everybody.
Right. I think it's a very good point, because we're still raising awareness on the concept itself, let alone treatment options. And I think a lot of Africans actually treat it like that Band-Aid principle. You're like, oh, I put a Band-Aid on it. I already saw one therapy session. I'm good to go. And maybe that's why we're seeing, non-returned users, is because,
Okay.
they think like, oh, it's a wound. I already patched it and I'm going to be resilient if it happens again. I'm going to use a similar approach as my therapist gave me. And I think like
Exactly.
we still have a lot more to go. And especially, like I said, and like you both said earlier, within urban centers are more maybe adaptive just because of technology. So, the good side of the stool. But it's still, even within the urban context, there's still people that they go maybe once and say, no, this is not for me. I'm already done. I can heal myself and I'm good to go. When it's, well, don't put a Band-Aid on it. It's like you said, at least 3-4 times, you need to see the progress, how that makes you feel. You need to, because mental health it's that invisible, I don't want to call it a disease, but it's that invisible imbalance of, something in your head, right? Something in your health. So it's not something you see. And I think a lot of people still struggle even with admitting that they have a mental health problem, when even something as simple as anxiety is a mental health problem. It is creating something that elicitates a negative effect towards the health. So, that's a very good point. And I hope you didn't lose Daniel. Okay, I think he's loading. I guess the next question will be to you, Josephine. So you kind of answered a little bit, but how does access to these mental health apps, or how does access to these mental health services come into play for Black communities?
Okay. As regards that, when I was trying to understand this mental health concept and all, I, apart from creating awareness, maybe individually in our social media posts, um, apart from outreach or talking about when it was mental health day, you see a lot of turnouts and people carrying placards and saying mental health. We really need to start doing programs. And when I mean programs, I mean back to back programs. That's programs that will bring consistency. And for My Care Body, is an organization that has structure. So we're partnering with different organizations. And there's one organization we're partnering with, Impact Hub. So they have a client base for female only, where they help women to start up their business, and then they partnered with us to offer medical mental health services for their audience, right? And we've been doing this for over 2 years now. So um I believe, and because of that, we've had returning clients. We've had
Right.
people who would come back to say, "Oh, I need another session," or what you did. I've had people come back to say, the tips you gave me, I did them and it worked.
Right.
So we, in order for Black communities to really gain access right now, awareness is good. Um, Social media posts is good, but it's time we start doing consistent programs, to make sure everybody is inclusive, even people with disability,
Right.
um, even the deaf, right? The deaf, we should include everybody.
Right.
Everybody should be. It should be a program. and and that will require lots of dedication and hard work. And I believe with time, since we're still in the stage of advocacy and awareness, which is actually good, like I said, is like watering the ground for people to just know, oh, okay, something like this is going on.
Right.
Then we'll start with programs that would really, really, really help and make a deep impact in their minds.
Yeah, no, absolutely. That's a really, really great response. Like we said, we need a lot more work, and these programs are certainly going to be very, very helpful. So this brings me to my second last question. I guess Danielle, you can start because we lost you there for a second. So how do you? This is just a takeaway message, and this is such a great topic, and I really hope we get to do part 2 of this because there's a lot we uncovered. So how do you, or how does one? You're both counselors, so this would be this would be a really good takeaway message. So how do you, or how does one encourage or can encourage Black communities in creating a safe space through these apps or through these technology in order to access mental health services? So how can we encourage better care for our Black communities through technology?
Yeah, I think encouraging the Black community to have this begins with giving them the assurance that it is a safe place. Because why people don't come, or why people choose to suffer in silence, is for fear of stigma, is for fear of accusations, is for fear of blame, is for fear of exposure. Like somebody comes with the issue, you engage them virtually, and then before you know it, it is everywhere. So somehow people can get discouraged. But when we give them the assurance that it is the way to go, let them be encouraged to get it, I think it will be possible that they can actually embrace it. And then equally, by the time we are doing this, we should be at all fronts, letting everyone know without borders. That's why here I decided that with my team, we are going to be doing more of community-based mental health advocacy and support, so that we don't leave anybody behind, so that we engage the politicians, we engage the religious leaders, we engage the cultural leaders, we engage the children, we engage the women, we engage the elderly, so that let them understand that this is a safe place, this is for their own good, and let them get to a place where they can actually access this. So that's what we have been advocating for. And I believe it is something that we can actually all do, so that we give them the assurance that it is the way to go, and we keep encouraging them. We show them the need and why it is actually fit for them to do it. And then from there, I'm sure everyone can rally behind this.
No, absolutely. I think that's a very good takeaway, just because, like you said, creating a safe space is one thing, but also letting people know that it is actually a safe space. Just because technology, and it may take away the variable of, the human interaction, it doesn't mean that you're still not interacting with the person, because you're still talking to a person. But also, reducing that barrier of, cultures that are associated with it. I think that's what you alluded to, is to say that, it is safe and it is borderless. It's not just created for, like you talked about, politicians or people in, in different institutions. They should also be involved, because it is, it's borderless, right? It's mental health. Like anyone from any country, from any place, is susceptible to feeling the symptoms of mental health struggles. And I think we lost Josephine there. Hopefully she will join us in a little bit. Oh, there she is. I'm just going to add her. Oh, great. Glad to have you back, Josephine. So the same question to you. So how can we encourage better care to our Black communities in the use of technology and the use of mental health apps? Do we still have you, Josephine?
Sorry, can I add something here, brief, as she comes in?
Yeah, go ahead.
Yeah, I wanted to just bring out, like you've said something which is very powerful here, from my own experience. In some of our African settings, by the time the community listens to any point or any idea that is coming to the people, if it comes from their own leader, they will take it wholesomely. But if it comes from somebody who comes from outside, they won't believe it. So first of all, one other way is, first of all, doing a vision casting and engaging the religious leaders, engaging the traditional leaders, engaging the cultural leaders, opinion leaders, so that they first of all buy into it, so that they become our mouthpiece, so that wherever they are, they can actually advocate for it better than when we are from here.
Yeah, absolutely. That's
Thank
a very
you.
powerful response, Daniel. Thank you so much for that. Josephine?
Okay. Mr. Daniel is quite grassrooted, and that's really, really nice. Well, okay, and I I would urge everyone, every black person, to be very, very supportive. Right? The fact that someone has decided to go for therapy sessions or for a therapy session doesn't mean the person is crazy or mad, and such person or such individual will need support.
Right.
I've had a client that booked a session for her mom and felt the mom needed it, and that was very, very thoughtful of her. And when I got talking to the mother said, "Oh, I never knew something like that existed." It was my daughter who said, since I've been complaining about stress lately, I should talk to someone. And she said that she usually hear that yes, you get to talk to a counselor and all those things, but it's not something that's occurred to her yet. So when her daughter brought it up, she took it up and said yes, she would really like someone to talk to. So that is a way of supporting and encouraging someone. If you feel someone needs a session, you talk to the person and say, "Oh, I know someone. I would like you to meet." Right? And then, for my own part, as a counselor, I have decided that to make it easier for me and for other counselors around, I was going to create blog posts, right, and put them on my Medium account and send to my audience, so they get to have an understanding of what they're feeling. I've had situations where people come to meet me and they have no idea on how to express themselves. So we will have to be doing the question and answer, or how are you doing? I'm fine, kind of thing.
Right.
So I decided to take that initiative to say, okay, based on the statistics I've seen on my sheet and based on the common challenges I'm seeing, based on the recommendations I'm giving, I would try to develop posts about these things and put them on my Medium account so people get to see them. It will help everybody. It will help me as counselor. It will help the individual. And I can urge counselors to be doing this also for their social media posts, and also to it's also a way of sensitizing people
Right.
to know that this would help in the long run. Want a situation whereby you come for the first session and we're getting something done. I know it's there's nothing wrong in coming to a counselor and then both of you sit down and be looking at each other for some time. It's not wrong, but we also need to get something done.
Right. And you have to
You're
start somewhere.
paying money. Yes,
Yeah.
you're paying money, so you need value for your money,
Yeah.
right? So these are ways I feel maybe people should help sensitizing, writing articles based on these things. I urge counselors or psychologists to do that. It will also help me to also be able to understand if I
Right,
have a client I don't really understand, like help me to understand, okay, this is actually what's happening.
right, right. No,
So that's basically it for me.
no, I think that's such powerful responses. People really grasp it as advocates as well. And I think it's just, you both alluded to something that is really powerful here, which is engagement and continuous encouragement. And whether it's to your mom, and of course, I have had, moms before where they're like, we didn't know this thing existed. Like, for example, just a brief example, like postpartum, postpartum depression in African communities. I think we all can say that treatment didn't really exist as much, and because it's just one of those things that was never talked about. And when we were telling some moms here that, oh, there's actually treatment, you can see a psychologist for postpartum, and they were like, we didn't know we could talk to someone. So it was just an eye-opener to them that there's actually such a service, because they all assumed that only like physical health could be diagnosed and could be properly treated, and they didn't even know that that was a mental health, or that was a mental health umbrella, or that was something that could be treated, even because they were like, we didn't know misfeelings of something could be a form of treatment. So it's really good that there's encouragement that needs to be done even within a small household, because it can make such a huge impact. And also what you said, Danielle, about people are more likely to listen to someone that resembles them, whether that's a political figure or that's someone from their country or someone from their cultural background. They're more likely susceptible to listening to a foreign person saying, oh, hey, here's a mental treatment for you, here's an app for you. So we still have a lot more way to go, but at least I think we're all safely saying that in the virtual health has benefited a lot of like Black communities, and I think that's a very good thing as well. So thank you so much for that. And I guess my last question is, where can people find you if you have any social media platforms, or any platforms that you would like people to have access to you in case you have any questions? I'll go ahead with you, Danielle.
Yeah, people can find me on my social media handles with the names Daniel Dlabara TB, Facebook, YouTube, and even LinkedIn. They can always locate me there. And then also, they can also access us through our website, Voice of Restoration International Limited. They can also always get us there. And we are based in West Nile. West Nile is bordering South Sudan and DRC Congo. That's why you find we are not very rooted this side. But ideally, that's where we are. But once a while, I come to Kampala as well. But that's where we are based for now. And yeah, people can always access there. And like my sister Josephine was saying, people need to document some of these issues, put write-ups and on some of these documents. Actually, personally, I have documented all my mental health issues into a book. Hope in the Age of Depression. That's why I keep telling people that, especially men don't open up. So I tell, please open up, talk. Because even me too, while growing up, I was told that you be a man and do the pace like a man. But by the time I realized things were going off hand. So I want to encourage the men out there who are watching this program today, please reach out for help. Help is available. If you can't go physically to meet somebody, like the way in the Bible story of Nicodemus, who went to Jesus at night, please find time to go to a castle at night. If you fail, please get these apps, download them on your mobile apps, on your laptops, and get services, get helped. Thank you so much.
Thank you so much, Daniel, for such a powerful and a biblical reference. Thank you so much for that as well. And I'll be sure to check out that website. And thank you for continuing to advocate for mental health and men and mental health. That's something we didn't cover today, and I hope we get to have many more topics on, especially technology and like mental health. I think that's a big topic in and of itself. So thank you. And Josephine, how about you?
Okay, I will start first by saying that here in Nigeria, we have an organization that is trying to make mental health accessible and quite economical. So for 1,000 naira, you can be able to have a or meet with a mental health practitioner, right? And it's virtual, so it's WhatsApp. So if they can go to mycarebody.org or they go to Oreos.com, those organizations, Oreos offer free medical mental health service, so you don't need to pay. For My Care Buddy, you will have to pay 1,000 naira, and um, it's actually quite accessible. So, but to maybe meet me, you just go. I'm on LinkedIn, I'm on Twitter. Um, I don't use Facebook and Instagram much. They are more of personal stuff. But for LinkedIn and Twitter, for my name, Josephine Emoma. I'm based in Nigeria, Abuja to be precise, the capital city. If you want to have a session with me, just send me a message on DM. I'm always online. I mean, for the fact that I'm a virtual mental health counselor, so I'm always online, and I will be willing to really talk to you. And my niches, the my area of concentration is stress, depression, anxiety, career counseling, and self development. Those are the areas I work with, and I found that a lot of people are going through a lot of stress related issue, and also panic attack over different things. We're having lots of unrest in different countries. Yes, so I'm here for you. Just send me a message on my WhatsApp, LinkedIn, and Twitter. Then we'll take it up from there.
Thank you so much, Josephine, and also for both of you for being able to join us on short notice. And I'm also very grateful that you did it in your time zone, which is really late right now, I can tell. But thank you, and hopefully we'll be able to host you again in future shows. And yeah, have yourself a wonderful evening, and thanks again for joining us. And goodbye for now.
Thank you.